expert panel that we have with us here today to kind of discuss a lot of these pieces. So I do want to introduce our panel, and I'll ask them to just give a wave so everybody knows who's who as we go through. I know, although we've got the names in little boxes, but I know a couple of us have a couple in each one. So first, we have Dr. Valérie Allusson. She is the Chief Medical Officer at Hackensack Meridian Health Mountainside Hospital. Doctor, thank you so much for joining us today. We have Dr. Arthur Calise. Dr. Calise is the Director for Emergency Medicine and Hospital Medicine at Hackensack Meridian Health in Mountainside. Doctor, thank you as well. Dr. Zaza Cohen. Dr. Cohen is the pulmonologist and practices critical care medicine at Hackensack Meridian Health, Mountainside Hospital. He's also an assistant professor of medicine at Rutgers, New Jersey Medical School. As a Rutgers guy myself, I'd love to see that. So thank you, doctor, for joining us. We have Sue Portuese. She's our health department director here in Montclair and doing a phenomenal job with all the contact tracing and efforts that have been going on to date. Sue, thank you for joining us today as well. We have Maya Lordo. She is the counterpart at the county level. She does a phenomenal job kind of coordinating the same things at a much broader level. She's the health officer for Essex County, New Jersey. Maya, thank you so much for joining us today as well. Appreciate that. We are also joined by our township manager, Mr. Timothy Stafford, here in Montclair. He is the hub of coordinating a lot of the efforts, interfacing with the county on many levels, and of course, making sure things go smoothly. Mr. Stafford, a big shout out for helping to coordinate the efforts on the snow removal today. So nice job on that front too. So well done and welcome. Thank you for joining today. And lastly, I'd like to introduce two individuals, David Pascrell and Shante Palmer. They are the co-chairs of the COVID-19 task force that I put together here in Montclair to kind of look at a number of issues with subgroups around residents and community issues, certainly our small businesses and also our nonprofits. They've been doing an excellent job shepherding that work and bringing forward great ideas and solutions. And they both join us today to kind of introduce some of these pieces to really kick this off. And then I will look at all the questions and put those out. So Shante and David, maybe I'll kick it over to you just to give us a little welcome and an introduction, and then we'll go from there.
Thank you so much, Mayor Spiller, and good morning, everyone. My name is Shante Palmer. I am the Director of Government Relations at Montclair State University and the co-chair of the task force that Mayor Spiller put together for the township. So just briefly, the task force is a voluntary, informal group that will assist the township in two critical ways: through information and recommendations that we can provide the mayor, the council, and the township manager, and through marshaling community resources and initiating ways to foster supportive action through organization and communication. And I'll let David take it from here.
Thank you, Mayor. Thanks, Shante. Good morning, everyone. It's a pleasure to be with all of you this morning on the snowy morning. I'm proud to be the co-chair of the task force along with Shante Palmer. And I'm just really thrilled that our community, because we're a special community, has come together to try to do something in addition to what our county has been doing, our township has been doing, our state and our federal government's been doing with regard to COVID-19. As Shante mentioned, the task force really serves in two capacities: informational, and what we're doing today really is to provide information about the vaccination protocols that the state has put together. It's probably not going to be our only information that you receive, and it's early on in this process. So please bear with us, but there will be additional information we'll be providing out as further phases of the vaccination rollout from really through the state of New Jersey. So it's a pleasure to be here. I also want to mention that we have a very special asset in our community in the form of Mountainside Hospital. I'm so proud to say that Tim O'Brien and obviously other experts at the hospital were able to put this together for us today, because they are the real experts on vaccines. And so I'm just thankful to be here, and I want to thank the mayor again for putting this together. Thank you, Mayor.
Thank you both, and kudos again for the work you're doing. Thank you so much. It's a really great benefit. With that, certainly we've got a number of questions that I do want to get to, but if maybe we could start off just with a little context, and if I can go around the horn in no particular order except what I see on my screen here. But if you don't mind sharing from your perspective, from each of my panelists, what it's been like in a brief overview, moving through the pandemic to get us to this point. And then as we are on the I guess, phase here of getting the vaccine in and out and distributed and people vaccinated, kind of where that's at from your perspective. Just give a quick overview of that. And then after we do that, I'll go into the questions from the members of the public who've reached out. So Sue, I see you in the first square on my screen. So I'm going to go to you first. So Sue, can you give us a little bit from the town perspective as to where things were, how it's been going through the pandemic, and then as we've ramped up and you prepare for the vaccine distribution, kind of what that looks like at this point for you.
So it's been a long road. Starting in March when we had our very first case, our staff all contributed. So we had not just the nurses, but it was all hands on deck. The entire staff got trained to do case investigation and contact tracing, and we've been doing that the entire time. Had a little bit of a lull over the summer, and it's ramped back up. So everybody's continuing in their efforts to try and contain the coronavirus. We're having some issues right now with people not willing to participate and provide contacts to help prevent the further spread. They're telling us that they'll give a call to their contacts. So that's a huge issue. And I just kind of want to get that out there, that if somebody from our department or the state or the county calls you and says that they're doing some contact tracing, to please participate. It will help us to help contain the disease. We've been doing a lot of prevention outreach, helping distribute PPE, and now we're on a road where we're trying to figure out how we're going to provide vaccination clinics. So I'll let Maya talk about the county site that we're participating in. But in addition to that, our department has registered to be a provider, and we'll be setting up micro clinics throughout town. So normally during flu season, we would go to the senior buildings and vaccinate the older residents for flu. We'll be doing the same thing with the coronavirus vaccine. Not as quickly as the county will be ready, but probably by mid to late January, we'll be getting out in the community and doing micro clinics. We're planning on a drive-through clinic for the community in general when that phase of the vaccine is available to the public. So in a nutshell, that's where we're at, but it's been intense.
Thank you for all you have been doing. Appreciate that.
You.
And you touched on a lot of pieces that people were submitting questions about. Are there going to be spots specific to Montclair? That there'll be some more granular pieces to that. But thank you for hitting on some of those components, because we did have a lot of questions where people were asking about exactly that and how we would be going out into the community. So
sure,
thank you.
I'll be here to answer more questions later too.
Excellent, thank you. Maya, well, you were mentioned, and I know you're engaging and doing this work at the county level. So why don't I go to you, and if you can kind of layer on that, how the county has been interfacing and working with the township, and then what the plans are as we move forward on your front.
Good morning, Montclair. So the county has, how did this start for us? So March 26th was our first testing site. I want to note that a lot of you in Montclair you are the second highest users of our website, essexcovid.org, as far as testing is concerned. So we're really happy that you are familiar with that site, because that is the exact same site that we will be using for our vaccination clinics, which will be starting next week. The vaccination clinics will be in starting off with 4 different locations, adding a 5th. As it pertains to Montclair, the Montclair location vaccination clinic is in the old Kmart facility in West Orange. The website will direct you to that location. It will be by appointment only, and we will be, of course, sending out reminders with that. The county is looking to begin vaccination, like I said, next week, depending, of course, on today's advisory panel for the Moderna vaccine. With that being said, the county will be offering the Moderna vaccine at all of our sites. The vaccinations will begin with the phase 1A individuals, and that is our healthcare force. And by the healthcare workers, we do mean anybody who's paid or unpaid health workers, and those include not just doctors at hospital facilities, because they themselves are looking to vaccinate their own staff. We are looking to vaccinate anyone in the community with a medical or a healthcare job, or anyone who is employed at a healthcare facility. And those individuals there's a wide range. Please look out for a mailer that will be going out. I'm thinking about Monday in all of your mailboxes that will specifically give you the population that is first to be vaccinated. As the phases expand, we will of course let every individual know within the county and of course in Montclair who then becomes more eligible for the vaccine. As the vaccine becomes more and more available, again, as Sue stated, the individual towns will be looking to do their own micro clinics. Our job here at the county is to get it out as soon as we can, to get it out to as many individuals as we can, and to get it done as quickly as we can. And that's it for me for now until other questions.
All right, great. Well, thank you so much for that overview, and really impressive to see how quickly you guys at the county have been able to, put a lot of that infrastructure in place. I was really, just thrilled to be able to join you the other day for the press conference at the new vaccine distribution center or at the old Kmart, and really just the infrastructure that you put in there, impressive in a short period of time. So thank you for that. While we, I guess, talk about, the role that government plays in really helping people and getting this done. You heard from the local town health officer, county. Why don't we go to you, Mr. Stafford, as the manager, kind of coordinating some of these pieces here at the town level. Tell us how that's been interfacing with all the different pieces here and how we are prepared to support the work of our, of course, local health officer, county health officer, tying in with what our medical professionals are doing and the advice we're getting from the governor and the state as well. How does that all come together from that perspective? Thank you.
Certainly. I'd like to say at the outset that the Township of Montclair and its residents, as well as all Essex County residents, are in fabulous hands. The County Executive, Joe DiVincenzo, his Chief of Staff, Phil Elagia, our County Administrator, Robert Jackson, Sheriff Armando Ventura, who serves as our countywide OEM coordinator, and Ms. Lordo, have been since March conducting a military-like operation. You mentioned, Mayor, that we toured the Montclair, what will be the Montclair facility for vaccination at the former West Orange Kmart site on Tuesday afternoon. It is impressive, to say the least. The rapidly changing circumstances require flexibility, but require almost immediate action. And in order to be able to start having vaccines take place, in accordance with the schedule that Ms. Lorda said the other moments ago, the county has had to move so quickly, and it has done so, but it has done so efficiently. They are ready to go, as she said, as of next week. Operationally, our township and all Essex County towns are being requested by the county to assist in staffing to ensure the effective direction of vaccine services. So we find ourselves in the place of having to contribute in the form of people. So we will be sending police officers, health department officers and personnel, OEM coordinators and personnel. And an enormous part of this operation, as I'm sure Ms. Lorda will talk about later on today, is the request for volunteers. There must be volunteer help in order to sufficiently ensure that people get the vaccine. And of course, we need as many people as possible to get the vaccine and also continue with the other what are now normal prophylactic measures like masks, hand washing, maintaining social distancing, et cetera, for this to be successful. So the township has been asked and is formulating its plan to operationally support the county with respect to its massive undertaking, for us at least in West Orange, and also with respect to what Ms. Portuese said earlier with respect to operating the local microclinics.
Excellent. Well, thank you so much for that as well. Appreciate all the work that all of you are doing. And now maybe I will turn it over to our doctors to give us some of the perspective, maybe, what the conditions are like at the hospital at Mountainside, what's the situation been like, through this pandemic so far, what the current status is, and then of course what the preparations are as we move forward into this next phase. So maybe Dr. Allusson, if I can go to you.
Yes, absolutely. So thank you for inviting us to speak today. It's really a real honor for us to participate. I am myself a Montclair resident. First, we would like also to thank the Montclair community for their amazing support of our frontline workers during the first wave. We are very grateful. We had donated meals, supportive cards, and social postings. So thank you, thank you, thank you. I would like to take a few minutes by giving you an update on the situation in Mountainside Hospital. So we've been averaging about 35 to 40 patients, COVID-positive patients a day, which is fortunately much less than the 160 patients a day that we had at the height of the epidemic, the pandemics in the spring. Since the beginning of the pandemics, we've recovered about 550 patients, and this does not take into account the patients that were treated and discharged from the emergency room. What we see here is that the severity of illness seems to be less. It may also be because we know how to deal with this disease much better. And again, our primary goals are really to treat everyone effectively using up-to-date treatments. When I say treatments, I think about, monoclonal antibodies, convalescent plasma, all of the antiviral drugs, like remdesivir, for example. And the other goal also is to really minimize exposure as much as possible. So every admitted patient in Mountainside is being tested for COVID-19 before being placed in a hospital bed. We have COVID units which are equipped with negative pressure ventilation. We have been able to expand our PPE supplies effectively. We have, in fact, also equipped the room with Wi-Fi cameras so we can even monitor our patients better. So, we think we are much better prepared this time. And the greatest news is that today, this morning, in fact, we received the first shipment of the COVID-19 vaccine. So we are getting the Pfizer vaccine, which is very similar to the Moderna. It's the mRNA vaccine. And, I'm not going to go into the logistics of giving the vaccine to our healthcare worker. I know a lot of this has been discussed already. But again, everyone in the hospital should get the vaccine. And we are really targeting first the people who are the frontline worker, as well as the people with chronic disease, diabetes, high blood pressure, and so forth. And again, one also of our biggest concern is also to maintain the workforce capacity. As I don't know if everyone knows, but you may expect some kind of systemic effects after getting the vaccine. So we want to make sure that we have enough people working in the hospital at a given time to provide the best care for our patients.
So thank you for that overview, and thank you all for the work that you've been doing so far. So really appreciate that. Well, right there. So Dr. Calise, maybe I'll go right to you to also share your perspective on where we are at as well, or anything you'd like to add.
Very good, thank you. I would like to echo Dr. Allusson's thanks to the Montclair community. I've never seen anything quite like it in my entire career. And when the first pandemic hit, the outpouring of support from the community was amazing, bringing food multiple times a day to our workers that really, really needed that, cards and letters to really keep our spirits up. It was amazing. Things placed in the driveway so that when you walk in, it really lifted your spirits. Now, having said all that, I think the most important things that we've developed through this second wave is clinical parameters that allow us to safely discharge patients home from the emergency department. And these parameters include, vital signs, obviously, and laboratory studies. And then when patients are sick enough to be admitted to the hospital, we work in conjunction with the hospital staff to start the modalities necessary to make them better.
Great, thank you so much. Dr. Cohen, would you like to add anything to your colleagues?
Sure. Again, I want to thank you for inviting us today to discuss the various aspects of the COVID-19 disease with the Montclair community. And I also want to thank the Montclair community for support that they showed us during the first pandemic in the spring. I think both Art and Valerie discussed that in detail. As far as the ICU perspective of the COVID-19 goes, we get to see the sickest of the sick patients, unfortunately the ones that require high-level oxygen support or ventilatory support. And during the first pandemic, during the pandemic in spring, we didn't have nearly as many modalities to treat our patients as we do now. The knowledge that we have as to how to treat, who to treat, when to treat is very different today than it was in March and April. And we definitely are looking forward to having a vaccine being administered because prevention is the best way to deal with this disease. Like Valerie said, we already received the first shipment, and I myself personally will be one of the first ones volunteering for getting the vaccine. I think Art is going to be there with me as well. So we're all looking forward to more systemic distribution of the vaccine, not just to the healthcare workers, but to the rest of the community as well.
Excellent, and thank you as well for everything you've been doing, and will continue to do so. Thank you. So with that, let's get to it. I know there is a ton of questions. By my last count, I've categorized and tried to pull them all together from those of you who've been emailing them. I'm still emailing right now as this has begun. I tried to grab a few more, up to over 100 questions. So we're going to try and get to as many as possible. Certainly there are a number that have been repeated. And I think that's fine because it shows there's an emphasis point on some of these. Some I'll ask maybe just a couple times to get that point through. But of course, we'll kind of go through each of the questions as best I can and get to as many as we can to try and answer these here. So the first question comes from Anne in Montclair. And I will just say that her question is, I'm aware of several cases where older citizens have been exposed to COVID-19 as a consequence of having a home healthcare aide come into their homes. What's the recommended protocol for reducing potential for that to occur with a home health aide infecting the person that they are attending to? Maybe one of the doctors, if you would like to give us what the best practices or protocols would be around something like that.
Yeah, so, the recommendations are always, the same. And in fact, I would like to add that even if you are getting vaccinated, the protection is not 100%. So we should always make sure to have the universal, the masking, having the mask that I'm wearing right now, as well as making sure that you wash your hands and that you respect I don't want to call it physical distancing, but it's really social distancing, but physical distancing, meaning making sure that you are 6 feet apart from someone. If a healthcare worker comes to your house, this healthcare should wear a gown and should be able to don and wear, correct, appropriate PPE to really minimize exposure for the patient, but as well for themselves.
Excellent. Thank you. Thank you so much for that. Let's go to the next question that we have. Let's unmute myself. Okay, great. Next is from Susan. I'd like to know what provisions are being considered to inform the community on a timely basis about how to arrange for transportation or to make an appointment to receive the vaccine. There are still many who lack internet connections or without reliable communications devices, particularly older residents. Without timely information, they may not be well served. Maybe Sue, I would go to you to start this one as to maybe some of the work that's going into planning to make sure the information is out there, maybe transportation is addressed as needed. You already alluded to the fact that we'll be setting up more micro sites here in town and trying to do that work and you getting out into the community. So maybe this is a good point, a good question to kind of get into a little bit of that. Thank you.
So we've had discussion with the county also about transportation. The consideration is being made to group appointments for particular, say a particular senior housing unit, to group the appointments and provide transportation up to the county site if that's where they want to go for their vaccination. that's still being worked on. That's still in the planning stages. But yeah, we will be going into our buildings to provide the vaccination to older residents who don't feel like they can make it up to the county site. That's not going to be an issue. And our communications director, any information that goes out in multiple ways. It will go on the town's website, on their Facebook page, Twitter, on the cable channel, and also to local media. So we get requests for information from the local newspaper, so it will be in there also. And if a resident doesn't have access to any of that, they can call the township to inquire about information as far as vaccination goes.
Thank you very much. And I think that's probably a good moment to say from the start, this has been a community effort. And I commend all of our residents for the coming together that we've seen and the support. So it's going to be on all of us to make sure we're messaging and communicating anything we may hear with a friend or a neighbor or someone else. So we're all going to do our part, but you see the work that Sue and our team here is going to be working on as well. All right, let's go to the next question. This one is from Jean. It says, how will people be chosen to receive the vaccine? Will they be given a choice of appointment times, any idea of a timetable, or is it too soon to know? Ms. Lordo, is that one maybe that would go to you, I guess, in terms of some of the distribution planning?
Absolutely. So just to answer a little bit more of Sue's question, those individuals who do not have access to the internet and aren't able to make an appointment via online, we have a fully staffed call center that will be open from 9 a.m. to 4:30 Monday through Friday, and we'll be able to make appointments for those individuals. As far as the timeline for the vaccine and the prioritization, that is determined by our state DOH and also our federal government. Right now, we are in phase 1A, which is open to our healthcare workers, as stated before. And those individuals will be asked that question when they go onto the website, and that will be the priority population to begin with. We are not sure as far as timeline is concerned when that phase 1B will be, and those are our essential and critical workers that includes our first responders, and that's going to be the next phase. We don't have an exact timeline for you on that at this moment.
Okay, thank you for that. And I think it probably ties in right to our next one from Kathy, and she gets right to the point. She says, I'm 71 years old. I have at least 2 of the underlying conditions, including cancer. I'm considered increased risk, and she notes, and should be on a priority list to receive it. How will she be able to get on the priority list, and how will they be notified of who is getting it when? So I think you talked a little about that as the state setting those parameters. Once they do and they open it up, let's say to that next phase, how will, and we have a lot of questions like this, so I'll probably pick a few more just to kind of tie in, but others were asking as well, is it a local, their primary care physician who's going to identify individuals that are in other categories or higher risk? Some asked, is it going to be on the honor system? Like, how is it going to be determined who is in that next wave or future waves when they have underlying conditions or things like that? And of course, we know, given privacy concerns and otherwise, there's some interplay there. So how is that going to be determined? Maybe, Maya, I'll go to you on that one as well.
As right now, we know this is one of the first vaccination efforts in decades. So we're all working through that. But I think the collaboration between the local health departments and the county will be able to assist that. So as soon as we know what once that new phase does come in, and again, that those new phases depend on the availability of the vaccine. The more vaccine there is, the more we can open up those phases. And working with the local health departments, working with Sue, we'll be able to identify new populations, get those out, and have the local health departments reach out to their community contacts and make sure that they're informed.
Okay, great. Thank you very much. So you mentioned, you alluded to, depends on how much vaccine there is. That's a good point to ask some of these. Here's the next question from Doris. She says, there's some reports of allergies to the vaccine. Can you please give some information on that? And as it ties in, how many potential vaccines are currently in the works? And can you tell a little bit more about them?
I'm going to refer for the allergy question to the doctors. And then as far as the other vaccines, I believe there's about a total of 6. But again, I'll refer to the doctors for that.
I appreciate you jumping in. I was going to go to the doctors on this one. I saw some of the pieces in that, so I appreciate you taking a stab at it. But absolutely. So, doctors, would you care to expand upon the number of vaccines in the works, some of the allergic reactions that we're hearing about? I'll tie it in now. I saw another question saying, how long will people be monitored? After they get any of these vaccines to make sure they're okay before they leave a vaccination center. So doctors, if you can maybe talk a little bit about the vaccines that we have, the safety, the allergic reactions, and all about that, if you don't mind.
Zaza, do you want to take these questions?
Sure, I'll try to tackle that one. So every vaccine that we have carries some risk of potential reactions, allergic reactions or otherwise. And I think that the studies that we have on this particular vaccine, for the COVID vaccine, did enlist a lot of patients, about 40,000 patients. But that's nowhere in comparison to how many people we're going to be vaccinating. So I think there's a good possibility that we're going to see additional reactions, additional effects of the vaccine that we did not see during the study period. So a lot of this has to be done carefully, and I'll ask Valérie. I'll ask Valérie to talk about our own protocol in the hospital, how we're going to monitor our own healthcare providers as they receive the vaccine. There may be a short period of time required to see whether or not the individual that received the vaccine has developed any reaction to it. But the likelihood is that if there is a reaction, it doesn't necessarily happen in the first 10, 15 minutes or half an hour even of observation. So I think many of the individuals that receive the vaccine will have to be sort of self-diligent and monitoring their own symptoms. It is well known that there are some systemic reactions such as fatigue and fever and sort of not feeling well in general for the next day or two after the receipt of the vaccine, and that's expected. We have tons of experience about flu vaccine that many people feel like they've gotten the flu, quote unquote, flu from the flu vaccine, which is simply those systemic reactions and systemic symptoms. So it's quite possible that many of us that will receive the vaccine will experience that, and we're trying to work into our schedule, vaccine administration schedule, the opportunity for that individual to take the day off for the next day. So I think that what we're going to try to do is you come and, let's say, take the vaccine today, and you schedule that vaccine on a day that you'll have some time to be home and perhaps recuperating from those systemic symptoms. As far as the allergies goes, I think that allergic reaction is always possible to an substance that the individual will receive, and exactly what percentage of people that receive the vaccine will get the allergic reaction, it only remains to be seen. I think that the studies that we have probably don't address that question very well because of simply the sheer number of the vaccinations we're going to give.
So I would like to add that there are only really two contraindications for this vaccine. The first one is, if you are less than 16 years old. And the second one is if you had any severe allergic reaction with any component of this vaccine. If you've had in the past allergic reaction or anaphylaxis for whatever reason, this is out of today not a contraindication. I think that what we do in this case is really to discuss, to have an informed discussion with the patients or with the staff, the team member, and to see really what are really the risks. So there is a risk assessment that is being done. To kind of piggyback on what Dr. Cohen said, you will have, you will or you won't have some side effects after getting this vaccine. This is called reactogenicity, this kind of fever, sometimes headaches, sometimes muscle pain. And this is all good because it shows that your immune system is really reacting. And it's a good thing. In fact, the immune system is working better with higher temperature. So having a little bit of fever is a good thing. Regarding the observation time after the vaccine, we usually keep the team member about 15 minutes to see if there are any side effects. And if the team member have any history or is immunocompromised or any immune disease, we tend to observe them about 30 minutes. Did you want to say something?
Yeah, I wanted to add that the recommendation for anybody that is prone to allergic reactions and not necessarily to components of this virus, like with eggs and some other vaccines, is that you get your immunization at a place that can handle severe allergic reactions if you really need to get the vaccine. Very important.
That was a great, thank you for that. That's appreciated, Dr. Calise. And that we had a number of questions where people were saying, if I have a history of allergic reactions, and eventually the question asks, if this is getting distributed at places like CVS's and other places, I'm not saying I know where it's going to happen exactly, but the question asked, how should they go about that? So I think that's the answer. So when we, to the number of individuals who sent that same type of question, again, just for emphasis, if I heard it correctly, if you've got a history of strong allergic reactions, you should get it at a place that is equipped to handle a potential reaction that you may have. Is there, and a couple of people asked this question, if you do have a history of allergic reactions, is there one type of is there one that you should get over the other of the two types that are out there now, or maybe even any of the, no? Okay, got it.
It sounds like they're both made of similar kinds of components. So, and one other thing I'd like to add is that with regard to reactions to these vaccines, they're in two parts, and you're getting them at one of the vaccines is 21 days, the other one is 28 days where you get the second immunization, and it's usually the reaction is a little bit more vigorous on the second immunization. So on the first one, you might not feel the muscle aches or the local site injection pain, but on the second, you may feel it.
Okay, great segue into another question, a few of them that I saw. Why is it important that people get the second vaccine of the same type versus just mixing and matching?
Zaza, do you want to take the? I see that
yes,
you are.
Sure. So the idea of doing 2 doses is to boost the immunity as much as possible. So immunity is somewhat a quantitative thing. So if you receive only one vaccine, the titers of the immunoglobulins, of the immunity, if you will, the level of immunity may not be enough in your body to fully protect you from the virus. And that's the purpose of the second dose, to boost that immunity, to increase the titer or increase the immunity, if you will, in general against the virus. Mixing and matching probably is not going to be recommended, even though those are similar vaccines. It's quite possible that the minute differences between the two vaccines will not necessarily provide the same type of boost effect that repeating the same vaccine twice would. So I don't see a big difference between the Pfizer or Moderna vaccine. So if you receive the Pfizer vaccine first, you should receive the second Pfizer dose and vice versa. So I think that the key part is that the second shot you get is the same as the first shot, and not to mix and match.
Another question that we saw a lot was, after that has occurred and after you wait the period, the questions were, will you still need to wear a mask and socially distance and do all those other pieces after you've received both your doses at that time?
Absolutely, and you should absolutely use universal precautions. It's just like the flu shot, and you just want to try to avoid it at all costs. So yes, the vaccination will help you, but you certainly have to continue wearing a mask, social distancing, washing your hands, cleaning surfaces in your home. Very important.
Great.
Absolutely, and the studies have shown that the vaccine is only about 95% effective. So you still have a small, but however minute, but a finite chance of developing the disease. So the universal precautions to prevent the transmission of the disease absolutely have to be followed, even after the massive vaccination effort.
And we still don't know if people are able to transmit. In fact, even as being vaccinated, if there is, how big is the risk of transmission?
And also that real protection from the virus with regard to the vaccine occurs 2 weeks after the second dose is given. That's when the full effect of the vaccine takes place. Although within 7 days or so, you're getting some immunity, full immunity comes 2 weeks after the second dose.
We had a few people who asked and were, everyone's obviously, it's something new. We saw the record speed that this was put forward, but people have also heard that it's a little bit different, that this is an mRNA vaccine. Can one of you explain a little bit of what makes this so unique, what that's about, and just tell people so they can feel comfortable with what that process was to develop an mRNA vaccine.
So maybe I can take that, or Zaza. I mean, mRNA vaccine is really a vaccine that contains some material from the COVID-19 virus, and to help cells to make, a protein that is really harmless. It's called, it's a spike protein, protein S, and this protein is going to teach our immune system how to destroy the genetic material of the virus. So the mRNA is like messenger RNA. It's almost like I think someone called it like the message in a bottle, and it kind of transmits a signal, and which is going to kind of direct our immune system to create defenses against the virus.
So it's not a live or attenuated virus. This is just small parts of the virus that kind of mimics that spike protein that's on the virus. So it teaches your body, like Dr. Allusson said, to recognize that spike protein, and then your body's defense systems will attack it. So it's teaching it to recognize it and to attack it.
Thank you so much. We have another question from Frank. He says, I've had COVID recently and recovered. Will that affect when I will become eligible for the vaccine in terms of, I guess, the priority listing? So where are people who have had COVID, where do they fit in the order of vaccinations? Maybe this does go back to you, Maya or Sue, I'm not sure. But where do they fit in terms of you've had it, you've recovered, where are you on the priority list? Do we know yet?
Priority list, no. We don't know that exact question as far as if you've had it, what your priority level is. As far as getting a vaccine, if you've had it, I'm going to refer to the doctors on that one.
So the first part was more, can you get it? We don't know when you'll be prioritized, but now we'll go to the doctors. You've had it, you've recovered. Let's take it to that next step. Obviously, I think we're all saying you should still get the vaccine. The question is, do you think that someone who has had it, if you were to advise a governor or others who are making these types of decisions to put those individuals in an earlier, later category as they normally would, what would you say to that?
Zaza, do you want to take this question? Or?
Sure. So what we know about the immunity against this disease is not great. We know that individuals that have overcome the disease, have had the disease and recovered from it, we know they have immunity. What we don't know is how strong that immunity is and how long it lasts. So, for example, let's say an individual had the disease in March and now it's December, 9 months later, would that individual still be immune from the disease? Or what are the chances that if exposed, he or she will develop it? And we don't know that. We don't know how long it will last. The only way we can do this is to test that particular individual for some titers, again, for the levels of the immunity in the bloodstream. As far as vaccination goes, that the immunity that vaccination confers, that immunity is typically considered to be weaker than the natural immunity. For example, if individual A got the immunity from the vaccine and the individual B got the immunity from the disease itself, the individual B that had the disease and got the immunity from the disease is considered to have a stronger immunity than the one that got it from the vaccination. So that brings on a lot of what ifs and maybes into that discussion. And I think that largely the answer to the question depends on how likely it is that this individual will get the disease again and what kind of risk factors he or she has. Again, if it's someone at high risk with multiple medical conditions, cancer, immunosuppression, etc., maybe it's wise to get the vaccine again. It can only boost the immunity. If it's an individual who's relatively young and risk factors are not there for developing a severe disease, maybe that person should be sort of further back in the line for receiving the vaccine. So there's still a lot of moving parts and unknowns to answer that question completely.
So I just want to add, I think that was great, Zaza. I just want to add also that it is recommended that you can get the vaccine if you've been sick with the COVID virus before. It's not a contraindication to getting it. And, the second part is that if you currently are sick with COVID, the recommendation is to wait 90 days after that before you get a vaccine. So not talking about prioritization, but just if you can get it.
You mentioned something as you were talking about that in your answers, and I saw a couple questions around this. do you foresee this is the type of vaccine that will be like the flu, where people have to get it continuously over time, like the flu vaccine year over year, or is this a one-time type vaccine?
So we don't know enough about the virus or the immune system responses to actually say whether or not we're going to be requiring people to get it every year like the flu. Dr. Cohen was mentioning before that sometimes we look at antibody titers in the body to see if you have an immunity, so to speak, status against a particular virus. But there's also a thing called a T-cell response in the body as well. So your antibodies might be low and these things may be high. There's a lot of factors that go into this. So we don't really know the answer to that yet, and don't really want to project what it would be at this time.
It's really more to come. I mean, it's a very new disease.
Fair.
I think the other part of it is, I'm going to add just a little bit, the other part of the comparison between the coronavirus vaccine and the flu vaccine is that influenza virus has various serotypes. So there are multiple types of flu vaccine, and every year it's not the same flu that we had the last year. One of the other types typically is more prevalent this year compared to the last year. So far, we've only had one type of coronavirus. So that's sort of good news. The bad news, if you will, is that we don't know how long the immunity will last. And if you're immune today, I don't know how long you're going to be immune for. So whether we're going to need the repeat vaccination every year, every 3 months, every 3 years, still very much determined to be seen.
Okay, great. Thank you. Next is from Annette, and she says, with the deep freeze necessary to store the vaccine, are there any preservatives in either of these vaccines? And I might as well tie in, I saw a number of other people asked, they know that other earlier vaccines had mercury, and some people have noted some of these things as preservatives and had concerns. So I guess I'll ask so I can check a few of these off here more broadly. Preservatives in there, concerns about mercury or other pieces, or anything else that's in these vaccines along those lines?
So there are no preservatives per se with this vaccine, with the mRNA vaccine. What we know is that the vaccine is really, there is a capsule, how do you call that? A nanolipid capsule that kind of, is around, envelopes the virus, and that's really the way for the virus to be for the mRNA to be able to get into the patient or the team member, the patient's cells, and this is how, in fact, the vaccine gets in. The antigen gets into the cells. So there is really no preservative in this vaccine.
Yeah, and there's very strict guidelines as to how to bring it to room temperature, how long it can last at room temperature, and when you have to deliver the medication to people, the vaccination.
And this is a technology that they've been working on since, I think, early 2005, and it is, in fact, really quite amazing that they've been able to kind of, make this vaccine in so, like in what, 9-10 months, I think. Using a very it's a new technology for the vaccine, but I know that the mRNA has been, they've been working on it for treating different diseases like cystic fibrosis and a few other diseases. So that's a really new use of this technology.
Thank you. Well, next we've got a question for Peggy, who is on the health department staff, so I guess I get the technical nature of her question here. She says, is the source of the mRNA synthetic, lab-produced, human, or from an animal? What happens to the mRNA? Does it hang around in the cell, or does it get destroyed? And her second part of it is, what would be your advice for an individual with regard to receiving the vaccine who has been diagnosed with CIDP, which developed after having the flu? So a few pieces.
To clarify, Peggy didn't come up with that question. A resident sent it to her.
Okay, all right. So I saw how technical it was. I thought it might have been her, but okay. So somebody did send that to her, and she forwarded it in. So a few parts, but doctors, if you don't mind helping us to answer those.
So the vaccination is made up of messenger RNA particles that are not live virus, okay, but it will induce the immune response, as we said earlier today. So it does not, the mRNA does not get into your cells and mix with your DNA material. And I know that's a very common question that people are asking. So it won't change your genetic makeup at all. It's really just there to stimulate the immune system to recognize those particles that make up that spike protein from the virus. So in other words, picture taking 4 or 5 nucleotides. Everybody's seen the RNA models and DNA models, and they kind of put that into this lipid nanomolecule, put it into your body, and then your body reads those particles and then recognizes that spike protein.
And the interesting thing also is that the mRNA is a very labile structure, so it really, it's very easy to destroy. So, which is why, in fact, they created this kind of capsule around it to kind of protect it and help it to enter the cell. It really definitely doesn't affect the genetic make because it doesn't get into the nucleus of the cell, which is where you have all of your DNA, which is your kind of your genetic print. And after that, it just disappears. And, the mRNA makes the protein and then disappears. So then you have the protein, which kind of stimulates your immune system, and you're going to make antibodies. I don't know if it answer any questions.
No, thank you for that.
Yeah.
And I know she had also specifically passed along somebody who's had or developed CIDP after having the flu. Would they be recommended to get the COVID vaccine?
I'm going to try to tackle that one. So CIDP, which is a neurodegenerative disease, can happen after any type of vaccination. And flu vaccine being used more commonly than others, it's well reported that it can develop after flu vaccination. That particular disease is also quite common after a viral illness. A very simple, regular viral illness is often associated with the development of that disease. So I think that the correlation between vaccination and development of that disease, CIDP, is largely connected with the idea that as the immune system is revved up, it attacks various parts of the attacker, such as virus, and sometimes it also attacks the individual's own tissues. And that's what happened with the CIDP. Likelihood of that happening again with COVID vaccine has not been well tested and understood. Again, the numbers that we have on these patients don't really allow us to know exactly what percentage will develop this effect, and it's more or less a random event. So that individual may receive a number of other vaccinations that will never happen again, and then alternatively, the next time it could happen. It's impossible to know whether or not this event will happen to that individual after the receival of the vaccine. I think that the corollary to that is that the vaccine is still safer than getting the disease. So it's much better to receive the vaccine and receive the immunity from the vaccine than to get the disease. So I would still recommend that that individual receives the vaccine, whether or not early or later in the process, depending on the other risk factors he or she might have. So I think the recommendation, with some reservations about the potentially developing CIDP again, the recommendation should still be yes to receive the vaccine.
Thank you for that clear answer. Next is from Jan. She says, I would be interested in knowing if individuals working in education with schools, children, or childcare who are not residents of Essex County but are employees in Essex County will be eligible to be vaccinated here, or will they have to go through their site in their own town? So I guess it's back to you on that one.
If they work in Essex County, they are of course eligible to go ahead and be vaccinated here in Essex County. Also, just anyone who is volunteering or participating in any of our vaccination clinics will be eligible to get vaccinated as well.
Okay, thank you very much for that one. Next question I have here is, this one's from Bill. Bill says, when New Jersey went through the measles epidemic 2 years ago, We were told that we needed 95% community vaccination rates to achieve herd immunity. Now we're being told that we will achieve herd immunity with only 70% vaccination rate after COVID. Why is the number so much less for COVID than for measles? Dr. Cohen, I see you shaking your head, so maybe I'll go to you on that on that one.
Sure. The comparison between measles and COVID is a good one. And the measles is one of the most contagious viruses that we know. So if you are anywhere near an individual who has measles, likelihood of you getting that disease is very high. It's very, very contagious. We're still learning exactly how contagious coronavirus is. Initially, we thought it was terribly contagious, that you couldn't touch anything in the vicinity that the patient had touched. Now we're understanding that probably the transmission of the coronavirus is somewhat similar to that of flu, which is not very, very contagious. And I think that any model that speaks of those percentages, 70%, 95%, 94.7%, those types of things, they're all estimates. And they're all estimates from some type of mathematical calculations, if you will. So we don't know exactly what percent of the individuals needs to be vaccinated in order to receive herd immunity. And I think that the difference in numbers and difference in those estimates come from the fact that the measles is a lot more contagious than coronavirus is. So you need a lot less of the herd immunity for the coronavirus than you do for measles.
Thank you. Next question is from Vivian. She says, she has a number here. She says, do vaccine formulations get tweaked as the dosages are given, or is it static once the FDA has given approval? How long will it take to get the necessary doses to get everyone vaccinated? Will people know which vaccine they're taking? I might add, and that because a couple people asked the question of is the county or we locally going to be picking one over the other, or just trying to give both out? When will children, and I'll repeat these because I know there's a few here. So when will children be able to be vaccinated? And how will we make sure that people who are supposed to be prioritized actually get prioritized, which again is a theme in many of these. I know we've addressed that, but I do see it so often repeated that I'll kind of put that out there again of how we are going to determine, and I know it was stated we don't know yet exactly that's going to happen, those priority lists, how we can confirm people are on it. So maybe just taking the first couple first, I'll split it up. Do the formulations get tweaked, or is it static after approval? And how long will it take to get it out to everyone? And then I'll go to the other questions and restate them.
Okay.
So I think that the formulation of the vaccination probably has to be stable, because we're looking at ongoing trials, and efficacy for these things. So I don't think that they'd be changing those at all right now.
No, there's not going to be any change in the formulation. And then how long will it take to vaccinate the entire population? I mean, how many millions of people do we have in the United States? More than 300 million, I believe. So, what we know is that maybe we may have some degree of herd immunity when more than 75% or 80%, and I don't have a specific number of the population is being vaccinated. But again, this is not a clear, there is not a clear answer. I don't know if you have anything on that, Zaza, that you want to add.
Yeah, I think Mayor mentioned children, and I in general will be somewhat cautious about children being vaccinated, because we don't have nearly as much data on children receiving this vaccine as we do for the adults. So that may be coming down the pipeline later as we administer this vaccine to the adults. Perhaps there will be other studies, large studies, looking at how do children react to being vaccinated. Also, from the general public health point of view, children don't seem to be very severely affected by this disease. So to blanket vaccinate every child may not be terribly wise, because they may develop more side effects than benefit from the vaccine. So there are a lot of questions to be answered when it comes to children, and I'm going to try to stay away from that right now, because we don't have a lot of data on children being vaccinated. But as far as the adults go, I think Dr. Allusson mentioned that we have millions and millions of individuals to vaccinate, and this process will probably take a long time, maybe months, if not a full year, to roll this out to everyone out in the country.
And just one more thing, the children were excluded in the trial, in the Pfizer biotech trial, as well as the Moderna trial. So that's one big reason not to include children. And I know that as we speak, they are in fact conducting a trial involving children and looking at side effects and efficacy and so forth with this vaccine. I know Pfizer is doing it right now.
I think it's a good time to, well, let me finish up the last piece of this, and maybe this is to you, Sue. Will the township get to choose which vaccines we're receiving? Will we be only distributing one over another? Will we be distributing either or both as we get them? The answer to that.
So the Pfizer vaccine, for the most part, is going to the hospitals because they have better capacity for storage for the ultra cold chain. I know in our site and in the county site, we'll be receiving the Moderna vaccine. People will be informed that that's the vaccine they're getting. And when they have an appointment to receive their first vaccine, at that time when they come in, they'll automatically get the appointment for their second vaccination. So they'll receive the same vaccine both times.
Okay, great. Thank you. Next is from JC, and he says, and there's a number like this, and I already read one earlier, similar. 70 years old, diabetic, want to get the vaccine as soon as possible, don't have a car, how will I be able to get there? I had a message on my phone from our county executive. He mentioned the testing site, but it's not that close to me in Upper Montclair. I would need a ride. I'm going to need information on where I'm assigned. How is this going to be figured out? Maybe I'd kick this over to David and then Shante. Part of the work you're doing is to communicate pieces out to the public, right? We're getting a lot of good answers today to a lot of these great questions from our medical team and our professionals here in town. But a lot of the work, and I'm seeing the theme here in some of these questions, is there's going to be some work to make sure people have ability to get around, but more importantly, have information on what they need to do or what they can do. How do you plan on, David and then Shante, how do you guys plan on disseminating some of this information, distilling the questions you will continue to hear and getting the information from these experts to people so they can, act appropriately and best protect themselves and help themselves and us as a community? David?
I think one of the main things that we're going to attempt to do is keep in touch with the state of New Jersey. As you know, much of the decision making with regard to the vaccine rollout is being managed by the state and through counties as well. So we're going to utilize all of those outlets that we've utilized to date. That is the Township website. And I was just going to mention, because this wasn't mentioned before, the Township has an alert system where you can sign up for it and receive a text message or an email, and we'll provide information if you sign up for that and haven't signed up already, that will give you information about location and at milestones that we reach along the way. In addition to everything else that we've done, I also think, Mayor, that it would probably be in our best interest to do another webinar at some point in the future, because what I'm reading is that there's going to be a very limited amount of the Pfizer and the Moderna vaccine. We have about 650,000 people that would fit within the phase 1A definition. And so we're likely to have all of the initial Pfizer and some of the Moderna vaccine be allocated simply for our frontline workers and our healthcare workers. And so I think this is the timeline is really not set in stone right now in terms of when phase 1B and phase 2 status eligible people would be, or the vaccine would be available to them. And I just want to clarify something that phase 1B would include, because there are a lot of questions I'm seeing in the Q&A, folks that are 65 years or older, folks that have some type of immune deficiency, and then essential employees. And essential employees really, or essential workers, catastrophic workers, are really defined by the governor in his executive order. And then it's really in phase 2, after that second phase, where the general public is going to have the vaccine that's available to them. When that happens, not really, I don't think we're sure. My calculation estimates that we have 245,000 individuals that can get the Pfizer and the Moderna vaccine that's already been reported by the state in terms of the shipments. First of all, we only have one vaccine that's been approved by the FDA so far, and that's the Pfizer vaccine. Moderna should happen, I think it's this week. I also wanted to mention there'll be a tracking system that the state of New Jersey puts together. I think it's called the New Jersey Vaccine Scheduling NJVSS. It was still being built, and maybe Maya can talk to this as of this week. And it's also going to track whoever received the first shot of the vaccine. The state wants to track, and certainly the county, to make sure that they follow up and get that second vaccine. So we're going to put this out in a number of different outlets. We certainly can't answer every question today, but the dialogue really has to continue as the phases move along and we open to the general population.
Yes, and I'll add that the most important, as this everything rolls out and everything is fast moving and quick changing, I'll just add that the most important part of our role, David and I's role on the task force as co-chairs, is to act as facilitators to get that information out. And it's so very important to work with our local and county, even though the state is rolling out information. It's very important to communicate that information, but coordinate with and get that information from Sue, the local health department, as well as Maya at the county, who will be administering and have those key details that the community will need. So it's very, very important to work closely with our local and state allies and get information to the community. And I can pass that to Maya if she wants to discuss the type of shots that's available in locations. Yeah.
So as far as what David mentioned regarding the scheduling system, so just before this call, we got off the call with the state. Our state website will be integrated into the New Jersey Immunization Registry, which is how we're tracking vaccine and who's getting the first and second dose. The other thing is, when it comes to the appointment system from our end, like I said, Montclair has been one of our biggest users of our website. So we're hoping that the familiarity of the Essex COVID website will drive individuals and be comfortable as well.
All right, great. Thank you very much. Next, I've got a question, and it's, I know that, and Maya, will go to you on this one because it goes through some of the testing pieces and exactly what will happen and how we're going to kind of lay that piece out. But the question here, of course, and I lost on my screen, I was trying to go in the chat and everything else, was around, when people go and get the test, how's this going to work? So Susan, here it is, asks, she got the call from our county executive, knows the location. She wants to know, will an entire family go at the same time? Will people be waiting inside the Kmart or in the parking lot? Will there be an appointment that's given after it? And how do you make sure that all those protocols are followed? So I guess a little bit more that's there, and I might tie that into another question that I saw, which actually had some comments as well. And it was around individuals. This woman was in her 80s, and she noted that she's often gone even for testing and has had to wait in lines, even though she's had an appointment, but then kind of has to be near or around other people. How will it be for the vaccine in terms of making sure people are able to kind of get in at their appointment time and not be in large groups, et cetera? So Maya, I'd put both those, I'll combine those and give those to you.
So all of our locations, the Kmart facility that you saw is almost a 2.5 acre facility. With that, we've established queues and lines for individuals to wait. There will be a pre-register. So you know what? Maybe it's best that I go over what the process looks like from start to finish, right? So you go onto our website, you go ahead and register. Once you are registered for the website, on the website, you will receive an appointment. You will be then that same day scheduled for your second appointment as well. When it's your appointment time, we will encourage individuals not to show up more than 10 minutes before their appointment time. We'd like to be able to have people hold their appointments. That's going to allow us to limit the amount of individuals coming through the door. Individuals will be able to wait inside, being that it is winter here in New Jersey. Once the individual is able to produce their appointment, a QR code that's associated in an email and a text message will be produced to our pre-registration staff. Once you are pre-registered, we will scan that QR code. You will then be directed to our registration area. At the registration area, we will make sure that your information that is going to be entered into the NJIS system is accurate and correct. You will then be given your vaccination card. That sheet of paper that has all of your information will also have the arm that you were vaccinated in, as well as the time that you were vaccinated in. After the registration area, there will be another queue for to ensure social distancing. You will then be directed into the inoculation pods. There will be 2 nurses in those pods. One will be administering, one will be ensuring that your information is correct and also documenting the time. Once you have finished being inoculated, you will walk over to our charting tables, which will then again verify your information, and you will be moved to our 15-minute monitoring area. You will know the time when the 15 minutes is up because it will be given to you by our nurses. The area that is for medical monitoring will be equipped with paramedics, doctors, as well as nurses at each one of our sites. So that goes back to what the doctor was saying, to ensure that if you are going to go ahead and get the vaccine, you want to make sure that it's an area where you can be taken care of as far as any adverse reactions. Also, what we plan on doing is having multiple individuals available for questions throughout the site. And then also, once you have completed your 15-minute monitoring period, you will go ahead and exit the area. You will then be notified 10 days, 2 days, and 24 hours before your next appointment as well.
All right, great. Thank you so much for that detailed information. Going through, and again, I want to make sure we get to the number that were submitted in advance, but I also see we've got a lot coming in the questions as well, question and answer session. So I might quickly just go through some of those, and doctors and others let me know an answer on this, or if I've heard it already, I think I'll try and restate it really quickly. So this is more to you. There's a question here. How can we help with contact tracing? Who should we call if we know information that would be helpful? I assume you're going to say, hey, just cooperate when someone calls you, but is there someone that people should call if they have information?
Our main number at the health department, 973-509-4970. If anybody has questions or information they want to share, they can call that number. But yeah, when we receive lab results daily, so if we have a positive lab, we know there's a case, we'll be calling that person. So if you receive a call from the health department and we tell you you are positive, please cooperate. We're going to be asking you some questions about your illness and who you had contact with, and for us to go ahead and contact those people and let them know that they need to quarantine. And, if they've got any medical questions or particular questions about COVID, we can answer them. But if we don't have that information, those people might not know that they've been in contact with somebody who's positive. They might not know that they need to quarantine, and they may be out potentially spreading disease.
Great, thank you for that. Next, we've got a question from Noel, who says, do COVID-19 patients at Mountainside Hospital have access to the same treatments that President Trump got, like some of the antibody treatments and other things that he received? So that's the question there. Dr. Cohen, you're nodding that head again. So listen, they become an easy pick when that happens. So if you'd like to maybe give us an answer on that, or any of the doctors, if you have any comments on, basically, seriously, are the same type of, we all heard about them at the time, these cutting edge, at the time, experimental pieces that he received. I think the status has changed on some of those, but if you could expand and say, are they available at Mountainside? That's the question.
Yes. So the short question is yes, all those treatments are available. Now, the longer version of that question is exactly what did President Trump receive, and how much of what he received is supported by the evidence, by the scientific evidence. So what we have available at Mountainside Hospital and elsewhere is treatments like supportive care, which is medications to reduce the fever and overall general symptoms of the disease, whether it's fever, shortness of breath, low oxygen levels, etc. That's sort of the simple type of treatment. Then as we get into more complex treatment modalities, there are antiviral medications such as remdesivir. And remdesivir is one of these tricky medications that it works when it's administered early in the process of the disease. So if you've had the illness for 2, 3, 4 weeks, it's not a good time to receive remdesivir. Usually the medication works the best at early stages. So the next wave of the treatment is monoclonal antibody, and Eli Lilly has a monoclonal antibody that has been approved for use, and we have that medication available at Mountainside Hospital. Again, the individual that is a good candidate to receive that treatment is difficult to find because, again, you need to give that medication relatively early on in the process. It's recommended that the monoclonal antibody from Eli Lilly is given to the patients to avoid hospitalization. So to some extent, it becomes a little bit of a conflict. How can the hospital administer the medication that is used to prevent hospitalizations? So what we need to do is come up with the regimen where we can administer this medication at a place like an infusion center. I think Art may be able to speak for this a little better. We may be able to administer this medication in the emergency department or a wing of the emergency department. So you come in, you go to this wing of the Mountainside Hospital, and you will receive the monoclonal antibody infusion, and it's an infusion, it's an intravenous infusion, and that will avoid the potential hospitalization or reduce the chances of potential hospitalization. To compare, President Trump received the monoclonal antibodies that were made by the company Regeneron, not by Eli Lilly, and that unfortunately has not been shown to be as effective as the monoclonal antibodies by Eli Lilly. The name for the medication is bamlanivimab. It's very difficult to pronounce that medication, but monoclonal antibodies are available. It's not the exact same antibodies that the President Trump received, but we do have treatment available. Again, those treatments, remdesivir and the monoclonal antibodies, are best used prior to someone getting really sick, prior to someone getting to the hospital and into the hospital, admitted to the hospital. Then sort of the next level of treatment is something that's reserved for really, really sick patients. These are individuals that require high levels of oxygen support, supplemental oxygen with the mask, with the cannula, or the worst case scenario being on the ventilator. And for those individuals, we have medications like dexamethasone, which is a very simple and old steroid. So many of us are probably familiar with the steroid medications, and that's what we use for really the sickest of the sick with the coronavirus. So it's a little bit sort of confusing. It's a little bit tiered, but the general idea is that the majority of the antiviral medications that are detected against or used against virus reproduction are best used at the beginning stages of the disease, and towards the late stages of the disease, we have medications that are more directed against the immune response of the patient rather than the virus itself. So I think I went into a really long diversion into discussion of the treatment methods, but like I said, the short answer is yes, but the long answer involves a lot of little details. So we don't have the exact cocktail of medications that President Trump received, but we have the best of the best available at Mountainside.
No, I appreciate you broke it up. You gave the short, concise answer for those who wanted it, and then listen, as an educator, I know you've got for the different learning styles. Then you gave the detailed there. Although noted, Noel, that might not include the helicopter ride, so we're not sure that that's part of it. But
I would like to. I would like to piggyback on what Dr. Cohen just said. So we do have, you have 2 monoclonal antibodies, and we are providing the treatment at Mountainside. We are in fact in connection with a lot of primary care physicians. We do. This is an outpatient drug, obviously. So the patients can be scheduled 3 days a week, early in the morning, and are able to receive this medication, the Regeneron, or the other one is the bamlanivimab. I believe Chris Christie got the bamlanivimab and Trump got the Regeneron. So we are able to give, this specific medication. As Dr. Cohen said, it has to be given early on at the beginning of the symptoms. Ideally, it should be in the first few days of being symptomatic. Again, you have to have also, you have to meet specific criteria, some of them being, having in relation to the weight or to some of the chronic disease. And what these drugs have been shown is that, they do apparently reduce by 75% relatively the risk of hospitalization.
Excellent. Well, being mindful of the time and everybody's time and everything that you've given here, I'm going to do just some quick rapid fire questions here that are coming in. Quick one, if you are pregnant or breastfeeding, yes or no, should someone receive the vaccine?
So, I can maybe answer the question on the. So, if you are pregnant or if you are breastfeeding, you could receive the vaccine. However, we really want people to try to speak to their OBGYN and discuss, risk and benefits. What we know is that the pregnant women are with COVID-19 are significantly more likely to be hospitalized, admitted to the intensive care unit, and somehow receive mechanical ventilations. So, you have to kind of weigh the benefits and the risk. The pregnant women were excluded from the trials. However, when we look at the benefits versus risk, we do think that it's probably better for these ladies to get vaccinated. Again, this should be a discussion with their healthcare provider as well as their OBGYN.
Sean, you're on mute.
You never always remember, right? It's just the deal with these, but thank you. The next one I have, I think you answered this already, doctors, but they say if you've been vaccinated, are you still contagious? Could you still spread the vaccine? I think I heard that there is a potential you could, so that's why you should still continue to wear your mask and take precautions, correct? I see heads nodding. So I just wanted to get that, but it was asked already, I believe, and answered already, so I want to note that. Next question. Jessica, are health home aides who visit people in their homes, like seniors who are bound in bed or have dementia, considered essential? And do they get a priority listing with other healthcare professionals?
The answer to that question is yes, they are in that phase 1A.
Okay, excellent. Thank you so much. The next one is, will the township administer sites? I think, Sue, you mentioned that we are going to have micro sites as well. We are going to get out into the public and do those other pieces to make sure that we are able to do as many vaccinations as we can. Is there a difference between the two vaccines? Are they equally effective with all populations, meaning the elderly and other groups? I know there's a slight difference in percentage, I think, or just minor, but are they pretty much the same effectiveness amongst all populations?
Pretty much the same. Go ahead, Zaza.
Yes, both vaccines are about equally effective. I think the exact numbers from the studies were 95% for Pfizer and 94.7% or 94.5% for Moderna. So for all practical purposes, I think that those are very closely, if not very similar, effectiveness rates. I think that as far as the general population goes, what needs to be remembered and thought about is what was the age distribution in those studies. So unfortunately, what Pfizer did was they used the vaccine in their trial mostly on younger individuals, for individuals younger than 55. So out of 45 or so thousand participants, perhaps only 5,000 or so were elderly people. The other question, the other sort of difference for general population was that because this was an international study, we did not have a lot of ethnic populations included. So if you look at the numbers of which ethnic groups the study participants belong to, great majority, overwhelming majority of the study was white or European ancestry individuals, 82% or so in the Pfizer study. So we don't quite know exactly how all of these percentages apply to a more specific and more narrow group of population. So the study showed that the vaccine is protective or effective in 95% of the population, but that's the general population of anyone from 16 to 90 years of age. What's the actual effectiveness in a smaller group population of patients, whether it's whites, African Americans, Latinos, or elderly? Exactly what the percentages are for those more narrow groups of population is really not well understood. But again, the short answer is yes, those two vaccines are relatively equally effective.
Excellent. And thank you for that, because I know Jeanette in the messaging had actually asked about some of the breakdown there that I think you just answered. So with that, I'll ask one more final question. Time Magazine says vaccinations do not prevent people from getting infected. These shots appear to keep people from getting dangerously sick. Is that an accurate description, or could you please clarify?
So again, I'll go back to the Pfizer vaccine, and there were a number of individuals that got sick in both vaccine group and so-called placebo group. So obviously there were two groups. One group received the vaccine, the other group received the dummy vaccine, if you will. They received the shot, but there was no vaccine in the shot. So when they looked at these populations, some patients that received the vaccine, or some individuals that received the vaccine, still got the disease. What they were able to really protect against is the severe disease that requires hospitalization, disease that requires more aggressive treatment. So will this completely prevent coronavirus from now and forever? The answer is obviously no. But I think that the idea of the vaccine is that reduces the hospitalizations, reduces the severity of the disease, but without really eradicating the disease. I think that we all want to hear that this is going to be another vaccine like we had for smallpox, and we have virtually eliminated smallpox from the planet Earth by vaccinating everyone. And unfortunately, this is probably not going to be one of those types of successes. But as long as we reduce the amount of the patients that get really sick from it, if we reduce this coronavirus down to a common cold that we all get probably every season, that would be a great, great, great success. And probably that's all we can hope for with this vaccine.
Okay, excellent. Well, with that, and I want to thank each and every one of you for your time today. I know that there were some great questions asked. We tried to answer as many of them as I can, but maybe instead of the classic closeout and kind of, that way, I'd like to maybe just go around really quickly again and in a minute or less. If there's something that you'd wished was asked or something you'd like to share, you think that's so important, as David and Shante said, we're absolutely going to do these again, and we certainly would welcome you back. Doctors, thank you so much. And also, Ms. Lardo, I know, who had to jump off for another one. She stayed with us as long as she could. A big thank you to her, certainly to Sue and Tim and our team. But if I can go around really quickly and just ask, is there something that you would like to share or wish was asked? And then I'll just give you our final parting thank you. So, Dr. Allusson, I'll start with you maybe.
I just want to emphasize the fact that it's absolutely amazing that we've been able to make this vaccine in just like 9 to 10 months, and I'm really, to me, it's a true joy because knowing that in some ways there is a light at the end of the tunnel. It's not going to prevent us from wearing masks and be doing social distance. I don't like the word social distancing. I like the word physical distancing better. So we'll still have to do that, but I think it's amazing, and I'm hoping that as many people will vaccinate themselves as possible.
I'd like to echo that sentiment too. What I'd like to see is everybody out there still being cautious, wearing your mask, washing your hands, making sure you're doing the appropriate distancing from people, because that helps as well in combating this virus. As we know, there have been a lot of cases that people have gotten because they're not really adhering to those protocols. So I would like to see more of that out there in conjunction with the vaccine. I think that will help a great deal.
Thank you. Dr. Cohen?
Yes, I agree with all that Dr. Allusson and Dr. Calise have said, and I will add that after seeing what we had to go through during the first pandemic in spring, seeing how difficult it is to treat the patients with this disease, a possible avenue of preventing the disease should be explored, and I think vaccine is a big part of that to prevent the spread of the disease. And in addition to all the distancing and masking and typical precautions that we all know about. So I welcome the vaccine very much, and I hope that, like I said earlier, we do accomplish the larger goal, which is to reduce the effect that this disease has on the population, reduce the number of people that get sick with it, reduce the number of people that get to the hospitals with this disease, and I think the vaccine is a large step in that direction.
Thank you. Ms. Portuese?
I would just like to thank you, Mayor, for having this session, and especially having the Mountainside professionals and the other professionals on the call is really helpful for us to promote our message also. And hate to jump on the bandwagon, but everybody needs to continue to follow the CDC and State Health Department guidelines to protect yourselves. Thank you.
Thank you. Mr. Stafford?
Thank you, Mayor. As you noted, Ms. Mordo had to jump off to attend another Zoom meeting, so I'll speak on her behalf and say that when vaccinations are available, the sites that Essex County will be hosting will be available from 9 a.m. to 5 p.m. And residents can make appointments by clicking www.essexcovid.org, or for those without internet access, you may dial 973-877-8456. Appointments can only be made after the county receives the vaccines. Vaccines will be given in 2 doses, as noted, and because it's critical that residents attend for both doses, residents that make reservations to receive the vaccinations will be given 2 appointments. So they'll know exactly when they have to come. And Ms. Loro said there will be reminders sent at various stages before that second appointment. Thank you for having me.
Thank you, Mr. Stafford. Appreciate that detailed information. I will also ask you to bring back to her, if you don't mind, a couple of individuals had asked if there can be at least consideration made for people who have to work 9 to 5 still during this time. So if you could just pass along to her that there may be opportunities or there could be a need for a day or something during the week where it's a different time or staggered time. So just noting that as well. So, but thank you for that information. Next
information get out that the county site will be open on Saturdays also.
Thank you very much. Great point. Thank you very much. We will be open Saturdays as well. So the questions that were asked there, that's a good response. Ms. Palmer, would you like to?
Yes, thank you all for participating. I'll just add that as a community, it will be really important to do your part, social distance, physical distance, as the doctor said, but also answer when you receive calls regarding contact tracing. Answer these calls and give that information is very, very important to help protect the community. And you may also receive communication from the task force committee chairs in regards to different surveys that we will be doing within the town, reaching out to small businesses, nonprofits, and to residents directly on a myriad of issues. So just please be responsive and be responsible. Thank you so much, and be warm, everyone.
Thank you. Mr. Pasquale?
Again, I just want to thank everybody for participating this morning. I thought there was a large volume of information that went out, and we've really only begun to scratch the surface. I guess my recommendation would be stay tuned. There's going to be much more detailed information as we move forward, and the Township website is really a great resource to start with, because it will send you to various other county and state sites that have websites that have a lot of information. And then secondly, I just want to thank the hospital again, because one of the things we wanted to try to achieve today as well is to allay people's concerns who don't have COVID-related illnesses, that the hospital's taking every possible precaution to ensure that when you're accessing it or need care that's outside of the COVID-19 space, they're prepared and taking every safety precaution. In fact, in the conversation I had, and the mayor knows this with the CO several weeks ago, they're doing things simply that other hospitals in the state are not doing to ensure non-COVID patients are getting the care that they need and stay safe. So I would thank them for that, and just want to thank the mayor again for putting this all together. Thank you.
Well, thank you, sir. And I will just close out by saying to all of you as panelists, thank you so much for your time today. Yes. But more importantly, even for really being a part of getting information out there, helping to people to answer people's questions, help people to really feel comfortable and understand the need and importance for the vaccine as we move through this, the need to continue with the measures we've been all engaging in to stay safe. I want to absolutely thank and commend my colleagues on the council. I know who have been very proactive and working hard to make sure we're doing all we can at this level to support our community, support certainly our residents and their families, and that's an important piece, in our businesses and our nonprofits and all the other components. So I want to thank them. I certainly want to thank our great team led by Mr. Stafford and Sue and all of you who just do phenomenal work with our health department and others. So thank you to the task force. And listen, you guys all have your regular work that you do, and yet you find time to do this work. So thank you to both of you as co-chairs, and also to everybody else who's participating in that, and so many others from the community who've reached out and said, we would like to help and support. And certainly, not leastly, but doctors, to all of you, I want to thank you. I know how busy your days are, and certainly the great work that you've been doing, the hours you've been putting in, the difference you've been making. So thank you so much for continuing that by helping to educate here today. We couldn't be more thrilled, as David noted, to have you guys in our backyard, if you will, to have an awesome hospital like you with great doctors to do that work. Is just such an asset. So we're really a blessed community in that regard. And for you guys to spend the time on here today, it means a lot, and we thank you for it. So to everybody here, to all the individuals who have tuned in, I saw the question a number of times, waited to the end to say it, but yes, we are recording this. We will repost it. We will put it out. It will be widely available. So just check social media, check our website, check everywhere else. We'll make sure we have it out so you'll be able to access this and share it widely. So again, thank you to all. I'm not doing my job if I don't have my ask. I'll probably lean on maybe you guys again to do another one at some point if there's more information, new information, changing things. And I think we all want to keep driving the message home. So maybe we'll have that ask. But for now, I just want to say thank you, everybody. Stay safe. Keep engaging in the practices that got us to this point. We're close, but we're not there. We're going to have to keep doing what we're doing. But as you do that, make sure you take the time to enjoy your families during the holiday season here. Stay safe, stay well, and enjoy a little time outside in the snow today. So thank you very much, everybody. Really appreciate you tuning in today, and thanks everybody for participating. Thank you, everybody.